COVID-19 vaccines, priority rollout. Australia. COVID-19 vaccines will be safe and effective, helping to prevent death and serious illness. According to Health Department Australia, first vaccine has been approved. It will be made available to those most in need of protection first. These groups have been identified based on expert medical advice. People at increased risk of exposure, infection, and transmission of COVID-19 include health, aged care, and the disability care workforce, aged and disability care residents, people in other higher risk settings, such as quarantine and border workers. People who have an increased risk of developing serious illness from COVID-19 include older people, people with pre-existing medical conditions, Aboriginal and Torres Strait Islander people. Priority access will also be given to people working in critical services, such as emergency services providers, defense force personnel, other healthcare workers, and people supplying and distributing essential goods and services, such as meat processing. The delivery of COVID-19 vaccines to those most in need will continually be reviewed based on medical data and evidence. Once the COVID-19 vaccines have been rolled out to priority groups, doses will be made available to all other adults. Research from the pandemic has shown that young people are less likely to have severe illness from the virus. If evidence supports the decision and the vaccines are approved for young people, they will then receive the vaccine.